Hi, and welcome to the post-COVID-19 Interdisciplinary Clinical Care Network Education Series. This video is the first of a three-part series in how to deal with headaches. As always, please remember that these educational modules do not replace a visit with your family doctor. Remember to take your time to watch these modules. Aim to limit your screen time by watching just a little bit at a time. You are welcome to look at any videos as many times as you wish or need. And if you haven't already seen them, you might want to look at our introductory modules. In this session, we're going to explain the types of headaches, explore things that might be triggering them, and we'll start developing an action plan to manage them. So, we know that people experience many symptoms following COVID-19, and everyone's experience is different. But headaches are one of the common symptoms that people report following COVID-19. While most headaches aren't dangerous, they can be disruptive, distracting, painful, and even debilitating. Not all headaches are the same. They vary in where they are and what they feel like. Some headaches come on gradually, and others start without warning. Understanding your headache and the triggers associated with it can help you find ways to prevent or improve them. You are the most important part of helping your headaches. Learning more about what causes them will position you to reduce how often you get them and how bad they get. It's important for you to keep track of your headache symptoms, where they are, how long they last, and any other things you feel when you get the headache. Try to keep track of what triggers or causes your headaches. What were you doing before or when your headache started? Do you find that something usually makes them worse? Pay close attention to them to figure out what makes them worse and what might make them better. And finally, be open to trying different ways to make your headache better. Different things will work for different people. So, you might be wondering, why am I having headaches? Well, scientists are still trying to understand the link between COVID-19 recovery and headaches. Some possible reasons that have been identified are inflammation, brain changes, stress and anxiety, and tension. Even if you don't know the cause of your headaches, there are steps you can take to help improve your headaches, how often they occur, and how much they affect your life. There are many different types of headaches. Some examples of common headaches include tension type headaches, migraines, local pain that's in the back of the head, the neck, or maybe even the shoulder, and cluster headaches. Having a better understanding of your headaches can help both you and your doctors treat them. We recommend that you keep a record of the type of pain you experience with headaches, such as whether the pain feels sharp, dull, stabbing, throbbing, or even like a pressure. Where your pain is located. Is it at the front of your head, over your eyes, at the base of the neck, or on one or both sides? When do your headaches happen? Is it a certain time of day? Does it happen with an activity? Does anything make it worse or better? And how long do your headaches last? Do they come on gradually or all of a sudden? Some common things we know trigger headaches are things like poor quality sleep, overstimulation, which is things like too much noise, bright lights, not drinking enough water, stress, certain smells, or even heat. Learning what makes your headaches worse can help you to avoid triggers or reduce how often they're a part of your life. Become an expert in your own headaches. The more you know about the patterns of your headache, the better you'll be able to manage them. Sometimes people find it helpful to create a headache journal or a log to record things like the type of headache, where it is, when they happen, what makes them worse, and how long they last. So what are your next steps? Take action. We recommend strategies like becoming an expert in your headaches, keeping a log, and recognizing what triggers your headaches. Take the Managing Your Headaches course. Just click on the link highlighted below the slides and make an action plan to try one of the strategies in the next week. Here's an example of an action plan. Decide what you're going to try and how you plan on doing it. Tell a friend or a family member about your plans and let them know how it's going. Thanks for watching, and come back for session 2, where we'll describe some options to help manage your headaches.